My Health. I think this is our sixth episode, and today we get to talk about a fun topic that's no secret to anyone. Buzzing around the media. You're hearing a lot of politicians. You're even hearing all the moms talk about Maha. We get to dive into this topic as kind of insurance experts and guys who've had a career in health insurance to just discuss some of the things that are going on in the Maha movement. I thought it was appropriate to bring my Make Health Insurance Great Again hat with me today. Funny, when I was with Remodel Health, one of our partners actually had these hats made during Trump's first campaign. So I've had this hat for a long time, but I think it's way more appropriate now that Maha has such traction and interest of the people. So you know, I don't. There's like 100 ways we could take this episode or this conversation, and that's probably where it'll go. But really, we just feel like you know there's a lot of uh, you know I want to how do I want to say this? There's a lot of facts, uh, information coming out around uh, maybe pharmaceuticals, maybe food and drugs, just all these things that affect healthcare or individuals' health in general. And so we feel like as an insurance company, we play a big part in that entire experience for the average American. And so what do we need to do as the first pro-life health insurance company that's coming to market, like to play a part in this Maha movement, and how do we support some of the initiatives of the new administration that are truly returning good health to Americans and to the food we eat and the drugs we consume and the care that we receive. So, guys, I don't know where we want to take this, but let's just dive in.
Absolutely. I'll open it up. So I think something that's important to recognize as we dive into this conversation is just the potential that this has as to be an historic moment in American history where we're at, I think by all measures, an all-time low. When you look at any measure of the United States health system, and performance is just not where it should be as a leading country in the world. You look at drug addiction, you look at childhood obesity, you look at heart disease. I mean, we're just not doing well on every measure. And a lot of it comes back to sort of like upstream of where the health system really gets engaged is like, how are we promoting health and are we taking care of our health as Americans? And I think what's interesting about this Maha movement is it's starting to really shine the light and zoom in on that upstream um, sort of care, like how we prioritize and address the system and address our own health and how we take ownership of our own health in the United States. I think that's something that's really interesting to see is sort of a bridging of the gap between across political aisles, right? Where you've seen traditionally, I think there's like this sort of idea of like crunchy hippies, like going for like the organic food section in the grocery store. And then you're starting to see, people who are more health minded, like young men, health minded. There's like sort of this Joe Rogan, um, sort of typecast of personality who's starting to get really engaged in their health. And I think this could be a really, and even you look at the leaders of the Maha movement, right? So you got Trump issued this executive order calling together this committee. RFK is Secretary of Health and Human Services right now. He's traditionally, been pretty left leaning, ran as an independent, and he's now chairing this. And I think that there's a great opportunity for our country to come together, regardless of your political leanings, to say, hey, like, right now, sure, a lot of the Maha statements and the committee's calls are sort of vague, but they're all great. Like we're at a low point. Like we kind of can't go any worse from here. So let's try something totally different. What do we have to lose? And can't we all get on board with the idea of like, hey, let's start taking care of our kids. Let's start reducing childhood obesity. Hey, let's try to, eat better and healthier and see if that has an impact on the health outcomes of our health system and shake things up while we're doing it. So I think this could be a major paradigm shift that could really be a catalyst for kicking off a new era in the way that we approach healthcare.
Yeah,
And I think one of the paradigm shifts, Bob, that I mean, you kind of, I've heard you talk about just how like this is more of like a grassroots movement. And it's like almost like the conversation is moving in the right place where we should talk about health. And like Cameron has like a hat on, make health insurance great again. I think I've heard the phrase like make health insurance insurance again, which is in a way like we've especially through Obamacare, like we've talked about healthcare totally in the context of health insurance, which I think is like a crazy thing to do, right? And so we're now kind of splitting that and saying like, all right, like healthcare has to do with actually keeping people healthy. It comes down to the individual, it comes down to the family. Like we shouldn't turn to the health insurance market to like how do we make people healthy. We should actually have people engage with this. And what I've loved, my favorite thing about this movement, I've kind of watched the podcast and all these things, trying to understand like what are they really trying to say. And what I love is they've rightly categorized what we have currently as sick care, not healthcare. We have this whole industry that's kind of propped up around what do we do when people develop conditions? How do we treat people with chronic conditions or have major situations like cancer, heart attack, stroke? And we have this whole structure that's only there to take care of people when they're sick, but not actually keep people healthy. And it's not just the health system structure, it's also like how we've developed our payer funding structure. So how do we actually fund this care, which we've gone, whether you think about Medicare, Medicaid at the federal level, kind of a government controlled, centralized, top down funding scenario, plus employer based coverage, which is also kind of this third party subsidized top down approach to health insurance and healthcare. All of that, I don't think there was like a nefarious thought process behind it, but it was just a reaction to what I think is rightly categorized as sick care, as opposed to like, how do we move from that to truly healthcare? But then I think what's missing in the conversation is like, where does health insurance, play a role into that? We can't throw the baby out with the bathwater, like you can't just get rid of health insurance. It still serves its purpose. But I think we're starting to rightly categorize like healthcare is for this, health insurance is for that.
Yeah,
Yeah,
and
go
I was
go
just,
ahead, Alex.
but even the hospital systems that you're exactly right. It's we're these hospital systems and these provider groups they've been trying they're trying to be as profitable as possible. They're trying to be manage profit, cost, all of those things. And you're exactly right, Daniel. I mean, we're looking at these systems that are designed to treat people at a fee for service, make as much money as they can. We're looking at that for the solution, and that's just not where it's going to be. You've seen the vertical integration of these hospital systems where they're employing primary care doctors, they're employing your specialists, they're employing
Hmm.
the surgeons, they're employing the physical therapist, the imaging, and they basically have vertically integrated your entire care path. That the moment you hop on that conveyor belt, it's like, okay, you're gonna go get your lab work down here in room 206. You're gonna go get your MRI, you know, in the next building over, and then you're gonna go see. And it's once you allow yourself to be put on the conveyor belt of sick care in the United States, it's you're at the mercy of the system at that point, right? And I think it is, as you said, and I think Bob said it, we have to empower people, which is what I love about Presidio, right? Which we have to empower our members and we have to give them the tools. And the traditional health insurance system over the last, you know, 30, 40, 50 years has not given regular people the tools to be better stewards, the ones that want to do that, the ones that want to be part of this movement. And that's where I'm just excited, where we get to break away from the traditional paths. And, if you need something and we can skip some steps and, you know, it, why do we have to follow the exact path that traditional care has only made more expensive over the years?
Yeah, and the health insurance piece of that you started to allude to, Daniel, with Obamacare, right? Like I always love a good analogy, but we've created this like concept that insurance has to pay for very basic like preventative services, right? And so like whether that's because sick care has like taken charge and like everyone's really unhealthy, so we feel like, oh, this is the right vehicle. I love a good analogy, right? So like you think about like auto insurance, it's kind of crazy. You would feel like your auto insurance is a lot more expensive if they said, well, we have your auto insurance has to pay for your oil changes and your tires and your brakes every time they come around for service, right? Yeah, your auto insurance would be a lot more expensive, but you actually have the liberty to go shop those services and pay for them when you want to pay for them, right? Like if you want to, if you want to be metal on metal with your brakes and not replace them, that's on you, and so you have that liberty to do that. In healthcare, you have that in some regard, but for preventative care, you know, there are several services that are required for the insurance company to pay for, contraception, being one of those. And these are not like high cost services, but in aggregate or in whole, it does create this precedence that the insurance has to pay for some level of it. It's on the auto insur or the auto or vehicle. When you buy a car for the first time, if you've ever financed a vehicle, the first time you do it, you don't realize what's going on, but the second and third time you finance a vehicle, you do. You go into that room with the little finance manager at the dealership, and they're like, okay, there's this warranty program, and all your oil changes will be paid for. Most people probably make the mistake of signing up for that and financing it as part of their deal. But it's just crazy to think that we pay for these things, and we're using Obamacare is using health insurance, which is supposed to cover you, it protect you from financial loss, right? And like financial ruin when a rainy day happens. But we're using health insurance to kind of pay for sick care, and we set that precedent. So how do we unwind that, and how do we move backwards and back to a place where you actually have the liberty to, you know, pay for the health insurance you need when the rainy day comes, and then shop for your services and be empowered to take charge of your health care, as an American. So I don't know, it's a really like timely movement in light of what we're trying to build here at Presidio.
Well, we should pause. I love that analogy because I think the right way to think about like how is like Maha actually going to shape like the American healthcare system in a positive way down the road is to pause on like that analogy of you said something like you don't know the first time you get a car, you don't really know the gimmicks that they're playing, but the second and third time you start to realize. So I think that's like a great place to just contemplate on, which is engagement, right? And I think that's the key word to think about with Maha, both in how we transform sick care to healthcare, just on the patient side, but also on the insurance side, is engagement. If you get people engaged both with your health, that's like a starting point. And I think the conversation is happening where it's like the path that we've been on with sick care is lack of engagement, where you're just kind of a passive player in healthcare. You don't even know what's in your food. You don't even know what's going on with the health system. You just go to a white coat doctor. They put you on 5 pills. You're like, all right, I guess I'm supposed to go on 5 pills, right? There's a lack of engagement where you're not learning the lessons of how to take care of your health and work through the system and understand what's best for you, right? And so I think the first step, what they're doing is they're kicking off that personal family engagement to say, like, what are key things that you should do? And don't even think about insurance. Like, it's if you're talking about something that costs, we like to say here, less than a Honda Odyssey. Like you don't need to actually finance these costs through insurance. You're probably better to actually take it on your own and figure out what's right for you. And Honda Odysseys are going out of control with costs, so we may have to change this to like a 2010 Honda Odyssey or something. But like, there's like these like blood panel type of companies and these new kind of innovative startups that are trying to create like apps to monitor your healthcare and how you're doing. And those, might cost 200, 300, $400 a year, whatever it is, but that you can finance on your own, less than the cost. I think the bigger thing is like it's creating engagement, that like if you do that, instead of paying Obamacare $20,000 a year so that you get one preventative service visit, so you sit in some sterile doctor room for 30 minutes where he's just like checking off and writing CPT codes. Instead of that, if you're tracking, all of your metrics and you're spending $400 and you're whatever it is, but you're engaging with your health, that is 1,000 times going to improve population health more than you sitting in a doctor's office for like 30 minutes for free. Which is the ridiculous path that we've been on. So
I think this is, sorry, go
yeah.
ahead.
No, go ahead. Good.
It's interesting because I think if you like peel the layers back a little bit on this one, it's really interesting to think about. Like I think one of the functions of government is to influence the values of its citizens, right? So how do we think about, and you can look at this with legislation like taxation on cigarettes, right? Like they don't want people smoking cigarettes because it's bad for the health, so they tax cigarettes to disincentivize cigarette smoking. With Obamacare, there was this theory that, and I think there's some truth to it, that hey, we want to make preventative care accessible, and we want to eliminate barriers to preventative care because we're putting everybody in this single risk pool, in the Obamacare risk pools, and we want to avoid these major catastrophic events. So we want people coming in and receiving their preventive care services. And that conditioned the American people. And I don't say this, I mean, like we're all part of this. I think it's conditioned us to think that that everything should be paid for through our insurance, and just let us like kind of push off that responsibility to our insurance companies, and to have like this mentality of we're just sort of sucklings on the system, as opposed to, like you're saying, Daniel, hey, let's take control here. I am the actor. I am in control of my own health. I want to go, and I'll just throw an example out there. We're starting a health insurance company. People have told me crazy things like, "Hey, why don't insurance companies pay for organic foods, because organic foods help your health outcomes and should lower the cost of healthcare." I 100% agree that organic food should be part of your health plan, but to like, why get your health insurance company involved in that? And just to like highlight, I think we could do some simple math here to highlight how crazy it is to get health insurance involved in places where it shouldn't be. And Daniel, I think your analogy at the beginning of just like comparing this to homeowners insurance, or Cameron, you talking and comparing this to auto insurance, like homeowners insurance isn't here to help you, buy stuff for your house and do preventative stuff for your house. It's there for when your house burns down, or there's an earthquake, or something goes terribly wrong. Auto insurance isn't here to help you maintain your car. It's there for when you get in an accident. But for some reason, when we approach health insurance, we have this idea mentality as Americans. We're sort of guilty of it, of thinking like we should be able to use it for every time we interact with anything that impacts our health, which is kind of crazy. So think about like, um, take a primary care. Daniel, help me do some math here as the actuary, right? Primary care, you go in for your annual wellness visit. It might cost $100, right? And what's built into that $100 is like the physician obviously has to get paid. That's probably the biggest expert that you're paying for. There's probably a nurse that takes your vitals. There's probably a front office person that's built into that as part of the physician's overhead. And then like, little things like rent and maintaining their medical office, that sort of thing. It's relatively low. And all that gets built into the $100 cost of your annual wellness visit, right? That's all that math sort of assumes that you're just like, you hand your credit card to the front office person, they run your credit card, and you're, they charge you and you're out of there. Well, if you hand them an insurance card instead, now all of a sudden you've got all these added costs to that point of service, right? The physician has to have somebody in the back office who's not just running your credit card for your deductible or copay. They're billing your insurance company, and then they're managing the response from your insurance company. If the insurance company denies a claim, if there's inadequate medical records to support the diagnosis or claim, if there's anything wrong with it, they have to respond to, right? There's a claims lag too. So the physician's not getting paid right away. That's a 60, 90-day payment cycle that they have to be compensated for. So there's a time value of money that gets built into there. So all of these little costs add up. And then on the insurance side, like they've got all their personnel that has to deal with this too. They're not running a nonprofit. They've got to run a business and make margins too. So they've got their claims adjudicators they've got to employ. They've got to make their own profit. So you add all of these costs in. So all of a sudden your $100 office visit's like 125, $150. It adds unnecessary costs to services. Now those costs are marginal. Of course it makes sense to have insurance involved when you've got something that costs more than the Honda Odyssey. But for these smaller services, especially like when somebody said, why doesn't my insurance company pay for my organic foods? It's like, let's think about this. Like, let's be reasonable and take ownership of our own health. Like, we should be the ones. It's like, if you're not healthy, like, you pay the ultimate price. So let's get that engagement back at the forefront.
Yeah, and health insurance adds no value there. I think that's what like Americans should try to think about is like, and they probably don't know where health insurance does add value, but where the health insurer does not add any value, you really shouldn't have insurance involved. And that's like the prime example, like a doctor office visit. They add no value to that scenario. I mean, like your health insurance, you could go cash pay 150, $200. And mind you, like when we think about insurance premiums, you can go to Obamacare and pay $2,000 a month for insurance premiums, right? So it's like when you compare 150 to 2,000, right? Like, and that would be if you're going to the doctor every single month, right? So, like insurance has value. Obviously, like where insurance comes into play is where like you can't pay. That's we use the Honda Odyssey because it's like, if something is over $50,000, that's going to be a significant financial burden on almost every single American's financial situation. So like that's a situation where you want to lower that exposure to those high costs, and it could be 200,000, 300, 500 million dollar type claims. Great value from pooling your money with an insurance company. Also, like if you're talking about just finding your local doctor, you could do that easily. But like, and you can like create a little cash pay scenario with local doctor, maybe even some of the local like surgeons and stuff like that. But when you talk about navigating the entire healthcare system, like having the insurer who has kind of buying power and leverage to negotiate contractual rates down and actually provide kind of a smoother path from like the point of the time where you need catastrophic acute care or whatever it is. And it's not, you're not going to be able to cash pay on a large scale. You can't just be negotiating and cash paying for like $100,000 bill or whatever. Like, there's value adds, but what you said exactly right there, that's kind of the right way to think about it is like, does insurance add value to the scenario? If not, like, it's a dumb idea to like add it as insurance. So
And there's no free lunches, right? I mean, you start adding up. I think we did an episode, Cameron and I, on just some basic costs. So if you have a $7,500 deductible, and you go buy an average affordable an ACA plan, an Obamacare plan, and you have, say, a knee replacement or a large procedure, you basically are in all in between your premiums, copays, deductibles, probably around, I think I have some of the number up here. I think it's like $23,000 is what you've paid for that procedure to get done. We can go get the procedure. I can go to probably 67 places in the United States and pay significantly less than $23,000 for a knee replacement. And so I think that's where we go back to, I think when you look at the Maha movement, there's the health component to it, which obviously is the key piece, right? We want people to be healthier, to have less chronic conditions, less bad things in the future. But even if you don't care about being healthier, this is not 1962 where your health insurance costs $500 a month and you have a $200 deductible, right? The
right,
system
$50 a month is
Correct, yeah. Like the system that we know has adjusted to these costs and these preventatives. There's no free lunches. So now you're looking at, massive premiums with massive out of pocket still, copays on everything. So even if you as a consumer don't necessarily, you want the easy fix on the healthcare side, you have an obligation to be engaged for your financial health, right? So there's kind of the twofold that the Maha thing, and just in terms of engagement, is going to be really, really beneficial for consumers moving forward.
yeah. But I don't think they've touched. Here's like I think where it's good for us to like interject ourselves a bit in the conversation is because they haven't touched on the payer system, the insurance system, and like this is I think the most complicated thing for people to understand is like it's easy to see how we've gone from sick care on the patient side. How do we improve our health? It's harder to understand like how we've gone to like a subsidized insurance and market where you just mentioned like $23,000 for the ACA. Barely anybody actually is exposed to that full premium dollar cost. So if you think about it, like 40% of Americans are on federally funded health insurance directly, which is Medicare or Medicaid. That's 40% of Americans, where virtually all of your costs, almost all of your costs, are subsidized in some part or all by the federal government. Then you have 150, 160 million, almost half of Americans, their employer covers their health insurance, which is 80, they cover on average about 80% of the premium and about 85% of the actuarial value, or like the cost sharing, the actual cost it'll cover 85% of the costs. And I did the math on this. In totality in the United States, 95% of every American who has some form of insurance is highly subsidized, meaning like over half of it is subsidized at least. 95. So everybody is not engaged. Nobody in America, virtually nobody in America is engaged on the health insurance piece. It's all passive, and it's all just like, okay, my employer covers it, my federal government covers it, my state government covers it. That's the set. So we've built a structure through incentives, through mandates, through laws to basically create this top down, let's take care of people's insurance by subsidizing it, which means like if you're not engaged, if you don't feel the cost, you just don't care. So I think that's the piece where I haven't seen, I think where Trump's administration is focused on, and we know some of the people involved, they're great people. I think what they focused on more is kind of the Doge aspect of like, how do we cut waste, fraud, and abuse, kind of that type of thing. I think I saw today, Cameron, there was like two insurance agents or something like in Florida and Texas who just got like indicted by the DOJ, and it's like $161 million of fraud in the federal government because they were like enrolling homeless people for free on Obamacare, because of perverse incentives and all this, right?
Yeah,
So I think
I know of these people. Yeah,
you know them personally. You had some drinks with them. You got
I
what?
yeah, I've
I assumed you didn't, but he's like maybe I
Plead the
don't.
fifth.
I don't know them personally. I've met one of them. I've shook one of their hands. Who I don't know if it's. I'd have to look up today who got indicted, but there is a federal case against one of the guys I know. There's some bad practices out there. I've never done business with this guy, and never would. But yeah, it's crazy. But yeah, those are the things they seem to be going after on the health insurance side. That's for sure.
Yeah, and they go for Medicaid. So like, if you take Medicaid, Medicare, I don't know what it is now. It might be close to like $2 trillion of our federal budget or something like that is going towards those two programs. They're
Like
trying to it's trying to get lumped into the Elon, like how much of that can we save, as opposed to like how do we restructure, is what I
well,
was going.
yeah, I think I don't know. Like, I would love to see some restructuring, and like, yeah, we would all love to see some restructuring is like how we approach like health insurance and the regulatory. We'll use a finance term, but like the regulatory, capture that exists like in health insurance space currently. But go to first principles. It's like kind of a waste to like restructure and reorganize when there's a bunch of fraud happening. And so that seems to be like some of their focus on the health insurance side is like cutting out all the programs or all the features of the system that create opportunities for fraud. Like you're always going to have people who try to defraud, the system, but um, there have been some rules, and there have been under the Biden administration some changes, especially on the Medicare enrollment, and then on the ACA enrollment side, that really just gave way to um, opportunities for people to kind of, you know, to game the system. Insurance brokers being a lot of folks who did that, and a lot of them probably don't even think they were. A lot of them don't even think they were doing anything wrong. Um, but there were several bad actors that are now, justice is being brought. So, I support the reset or the cleaning up of the system. But yeah, I'd love to see more of a bigger picture kind of restructuring of how we approach things. And that's probably to come for sure. But
like you said though, Daniel, until people are personally responsible for the dollars that go out, until it impacts their bottom line, which is, there might only be that 5%, but come to Presidio, right? I mean, that is our target market of people who are saying, yes, I want my dollars to be used responsibly. I want to take some initiative here. I want to, we're going to go for a walk instead of watching a TV show, whatever that is. There has to be there has to be a pathway for people to do that. And I think at Presidio, that is what is going to be different about what we do is we are going to give you the tools as a consumer to say, yes, you can push this envelope as far as you would like to push it to make sure that you're being a steward of your dollars. And like I said, that's come over, like get rid of the Blue Cross Blue Shields, get rid of your bucas, get rid of business as usual and come to a new path and start over and have the opportunity to do it right.
I don't mean to like shift the topic, but it's just something you said for some reason sparked in the back of my mind. But what role do you guys see in like? Do we feel like insurance plays in the like chronic medication, you know, medication space? Like that was one thing I think about with like healthcare sharing programs. I actually would give them credit on this. You know, like a lot of times they don't cover drugs, you know, for more than 6 months, right? Like they don't want people on maintenance meds, so they're kind of promoting. They're doing two things, right? They're avoiding bad risk because if you're on a maintenance med and that's important to you, you're not going to join the program. And two, they're promoting this idea of get off the drug, right? And so, uh, curious, like what insurance, you know, we have other episodes on, you know, the good, the bad, the ugly of healthcare sharing. So I don't want to like get into that, but I'm curious, like what's like health insurance's responsibility? How do you empower and engage like consumers when they know that they could just, you know, get the drug paid for with their health insurance plan, right?
Yeah, I'm sure Alex, you have some thoughts on this here because like the chronic. Yeah, I mean, I want to hear your off the cuff reaction
Yeah,
to.
I don't
Was it a good thing that health sharing stopped payments of like you can only be on this for like 12 months or something, whatever
yeah.
it was.
So I mean, I'd be careful how I say this, but the last guidelines I looked at, a vast majority of healthcare sharing had a 6-month limitation on drugs. And that's everything from chemos, maintenance type stuff. And the idea being that they did not want those long-term conditions under their purview, right? So you would encourage you to go find an Affordable Care Act plan. I don't, so in terms of insurance, I mean, I think we're opening a can of worms of PBMs, pharmacy benefit managers, where these insurance companies now own the PBM. So it's like the insurance company isn't making money on the drug, but the PBM, the pharmacy benefit manager, is making a ton, and they're a subsidiary of the insurance companies. We're opening a whole can of worms, but I think it goes back to as Daniel said, it is when it's out of sight, out of mind. And I don't think it's out of sight, out of mind. I just don't think people think about it. Even employer funded health plans, those dollars that they're spending on healthcare, they're either pushing that cost to you or you're not getting a pay raise because that health insurance is so expensive. And so to answer the drug question, it's a matter of, okay, if I'm with a large insurance company and I'm on a name brand drug, is there a generic that I could easily switch to that is, 10% of the cost, right? And so I think there are certain situations where we're not going to get away from the premium drugs, cancers. There are a lot of items out there where we want to push the envelope in care, right? Going back to true insurance, right? You have a cancer condition. We want to push those envelopes and try to find drugs that potentially could eliminate those. But when you're talking about cholesterol and you're talking about, I mean, insulin is the one that's in the news, right? How about this? What was it? This is not a human thing, but my dog. So my dog is on this thing called Apoquil. Do you know you cannot?
Goodness.
We stopped doing it. We started giving her the Greek yogurt for her gut health or whatever, and she doesn't have to take the Apoquil anymore. You cannot go buy generic dog allergy medicine. It's insanity, right? It's $100 a month. And so I think when we have the opportunity to have people be engaged in that process, and a large part of these maintenance medications out there, there are adequate, more affordable um, options out there that again, the insurance companies, the pharmaceuticals, like I think I've told you guys, healthcare is 1/6 of our GDP. That's nurses, doctors, hospitals, PT, the subway in the hospital, all of there, it's 1/6 of our GDP. So in order to, if we're expecting the system to gather those costs and reduce them on their own, I'd like to see which hospital or which doctor is going to raise their hand and say, yes, I'm willingly going to take less money this year, right? So it goes back to what a big part of what Presidio and this Maha movement stands for is we want to create a fertile place for you to come and be responsible for your healthcare.
Yes,
And that's
definitely fertile.
yeah, fertile and babies.
Definitely, yeah. We want to create a very fertile
Very
environment
fertile
through
place
the
for
health insurance.
everybody. But I think if you can combine that health component with the financial stewardship, it's how we truly move that Maha movement forward, right? You can be a part of that.
So Alex touched on I think your question is great. You touched on like the cost, like how do we get to lower cost on the drug side? But I think there's also like, how do you make sure people don't get on the chronic conveyor belt? I don't think an insurance company should step in and say like, you don't need your blood pressure medicine or you don't need this, or like, I don't think I really agree with the health shares approach of like, we're just going to cut you off at 6 months, 12 months, just like arbitrarily. It's kind of insane for an insurance company to do that. But like, I think that like what this movement is speaking to is like, before you jump on that conveyor belt, there's probably 8 out of 10 people should be thinking about what's the real actual problem going. Is a metabolic problem? How do I solve that? And how do I take care of that health before jumping on the conveyor belt? And so I was dreaming about this like from the insurance side, and we're learning. I think this is why we want to do these podcasts. Like, how do we learn as an insurance company to like think about these things creatively? Creative thought. And we're not doing this out of the gates, but maybe as a team, like let's try to get here. You imagine you enroll with an insurance company. You have it covered, your higher cost situations. You know that there's no gaps. You're not going to go bankrupt. Okay, you're set. Number two, you get access to very like a partnership with some of these kind of new innovative companies that are trying to help people monitor their health. We
Like
go out and say like
levels or
levels. Yeah.
function health or what
Yeah.
have you. Yeah.
So these people that are trying to get you engaged, okay. One thing insurance companies can do is like at scale, you can get like discounts because it's like they'll work with you as opposed to an individual. Let's get our members like great discounts for some of these like a partner that's going to help you monitor your health, and let you decide, right? It's kind of part of your health plan program. And then like we're already doing this. We're already building a physician tool. We're actively engaged trying to find the physicians who are not just a part of the system, who are just like, let's just put people on conveyor belt. People who actually care about the human person, both from like a spiritual level, but also like physicians that actually want to treat you as a human, not just like a number to put on the conveyor belt. Okay, we as an insurer can then say, here's our partner to help monitor your health. Here's the physician that like is better equipped and more willing to kind of like personalize your healthcare. And we give you access to both of those, right? You still have to be exposed to some level of cost to get that engagement, but we can kind of create those channels to like, now you have the tools as an insurer. And now instead of like, and we'll still cover the chronic medication, right? But the point is like, we want to give you the tools at that point before you hop on that conveyor belt to then say like, okay, I'm going to take care of my health. I got this physician who's like a quasi health coach looking at my statistics that are going on. I got this tool to help me monitor. I'm engaged in this. And like, if I'm one of those 2 out of 10 that can't solve this naturally, I still have my insurance company that will pay for the chronic conditions, right? And that avoidance there's only two things that run up costs. It's utilization and unit cost, or the contract with the physician. That's utilization control, where I think insurance companies will have some incentive. But again, if you're stuck in the Obamacare world, they're forcing all that cost to like sitting in the 30-minute office visit instead of thinking creatively, which is why like central planned economies are the dumbest thing. It's why communism fails, is because like this conversation that we're having, the bukas can't do this, right? Because they know that they get their money from the federal government. They know that they get money from the top-down systems. So they're not thinking about the patient. They're just thinking about like, how do I be the best version of what the federal government wants me to do and collect all those subsidies and funds?
And it
Kills innovation when you centrally plan stuff.
and
But
it goes back to the fee for service. And you said a very important word in this process is human, right? And I think as Presidio, as we build this out and we have aligned providers for both pro-life and how we're operating and treating our people as humans, we have to find those providers that they're willing to say, listen, if I get this patient better, they no longer are a fee place for me, right? Like I can't keep billing and billing and billing and billing that human versus for that provider that's on a maintenance drug, or someone who's just like they're just maintaining their current condition and just making sure it doesn't get worse. It's a paycheck every time they walk through the door, right? And so it's one of those things that's so personal to me that as kind of my role here at Presidio is we want to take you in your most desperate moment, and we don't want to just treat you like a number and run you through the system and we want to treat you like the human being that you deserve to be treated as, and we want to come alongside you in that process. And yeah, Daniel, I mean, at the end of the day, it's this weird world we live in, right? Where we've dehumanized so many things. When you talk about, a baby, we somehow have come to this place where we call it a fetus, right? Or a clump of cells or whatever, it's baby, right? It's this sweet, precious baby.
Fetus is Latin for baby, right?
Yeah. And
Is that
we've just dehumanized people, and we have basically now categorized them in their condition or whatever they are, and we need to go back to humanizing them. And I think as we build out this group of providers that are like-minded, I think we're going to be able to walk a stronger, more productive, healthy path for our membership by aligning those pieces for them. Again, providing them tools that if you want to take the steps to be a healthier person or have a healthier family, we're going to give you access to those tools to do that.
Yeah. Well, the insurance piece were mostly like up against here, or we're ripping on, right, is the central planned approach, is like your individual market, your ACA market, and the fully insured market. I think could do better, but if you've got a good TPA in place and you got a good broker on the self-insured side, your large corporations, like they're already doing some of this stuff. Why? Because the employer feels the pain of paying claims, right? And so the HR department, the employer, like they feel the pain of, they want to control those costs. And at the end of the day, like, for consumers, the average consumer or the person who just works for a small business, um, their premiums paid for, or it's highly subsidized by the government. They're not really like feeling the pain of the cost of care or the cost of them being sick. And so that's one of the things that's interesting about ICHRA, right? Is like, as more employers start to adopt the ICHRA, there'll be a lagging effect, on the carriers to kind of like straighten up, because the actual employee or the actual homeowner, right, the actual person, taxpayer, is cutting the check every month for their health insurance premium. At that point, the premiums are going to become kind of a race to the bottom for the consumer, right? Even though that they're getting a reimbursement, or it's getting paid for in some way by their employer, they still have the pain of writing that $800, $1,200, whatever it is, check every month to pay their premium. And they're going to start asking the question, for what? Like, what am I getting for this? This health insurance isn't giving me anything except for my condoms. right? And so, they're going to start asking those questions. And so I think
Define
that,
ICHRA for the. I know we know ICHRA, but like just so that people
yeah,
don't miss.
individual coverage, HRA, ICHRA allows employers to contribute in an equitable way. They can, to their employees, right, in a fair and non-discriminatory way. They can contribute money to an employee's premiums and if they choose medical expenses as well on a tax-free basis. So they can, give every employee $500 a month. They can base it on age. They can base it on where they live, how much they give them, and that employee can use those dollars tax-free to go out and purchase their own health insurance. Currently, they have to purchase um, ACA compliant health insurance. So that's going to be Obamacare plans on the market. In most cases, most if not all, they're not going to be eligible for any tax credits. So it removes the government, subsidy for that health plan. Now, the carrier themselves are still getting, you know, they're still centrally planned, right, by the federal government. There's some control there, but the actual taxpayer, the actual, individual paying for that premium is paying for that out of their own pocket, and a portion, if not all of it, might be reimbursed through their paycheck from their employer. So you got companies like Remodel Health, Take Command Health, Zizzle. I mean, Thatch. There's a ton of them out there that are building really innovative solutions to kind of help mostly mid-market and down small employers. From a couple hundred employees down to um, one employee move to this kind of ICHRA model. Uh, it's it's going to create more interest from the consumer, but also the carrier to be more creative in terms of paying for these sick care type services that I think you see in you know the healthy growing corporation that's a self-insured type model where they've got their own PBM contract, they got their own reinsurance contract. They're doing some really creative things. They've partnered with primary care clinics, or they have their own on-site clinicians that do preventive care for their employees to reduce that cost. So, you get that type of behavior in a self-insured world for large corporations, but you just don't see it, for smaller businesses that either have aging populations that are unhealthy, or, small businesses with a handful of employees that just don't have that purchasing power. And it'll be interesting as ICHRA grows to see what it might do to change some of the behaviors uh, around sick care. If that makes sense.
Oh, yeah. What's really weird about the healthcare system we've got right now is it's not your traditional economic scenario where you've got a consumer and the supplier and they interact directly with each other, right? So the consumer is driving demand, the supplier obviously driving supply, and they try to match each other in a perfect economic scenario. And what we've got in our current health system is it's like a three-party system where it's like the consumer is the patient, the supplier is kind of the provider, the physician, and then you've got this middleman, which is the insurance company that gets interjected into a lot of transactions. And that really complicates the economics. It sounds simple, but it like really makes things difficult. It's hard to shop for care. It's hard to know exactly what you're getting. And then Cameron, what you're talking about, what's cool about the ICHRA is there's this whole other dynamic in the healthcare system where virtually everybody, Daniel, what did you just say? 80% of Americans are getting 95%
95%
highly
of
subsidized.
insurance.
So what does that mean? It means there's somebody else making decisions on behalf of, or stepping in and limiting the decision power that the consumer has outside of that triangle. There's like a fourth party, whether it's your employer who's subsidizing your insurance and they're choosing the insurance that you're eligible to purchase, or it's the government that's subsidizing your insurance. So the ICHRA model gives that freedom back to the consumer to say, you've got all the tax incentives that you would otherwise have, which is, I think, sidebar, like that's kind of a weird tie that we've got tax incentives if you choose one of your employer sponsored coverage options. We could talk about that in a different podcast, but you get all of those tax advantages, but you also have the freedom as a consumer, as an actor, to go to the market and purchase whatever plan you'd like to purchase. So I think, again, bringing this back to like autonomy of the consumer, and kind of like breathing in some free market principles into the healthcare system, which has been largely driven by, there's been largely a movement towards consolidation and single payer, and trying to get this back to the consumers, give the consumers control of their decision making.
But consumers need help sometimes too. I think that's, you start, because the other free market piece is the lowest bidder, right? It's like we're completely fine sending astronauts to space in the lowest, and like the spaceship that was built by the lowest bidder. We're completely fine driving across a bridge that was built by the lowest bidder. We're willing to do all these things by the lowest bidder, but when the moment you have cancer, you're like, not sure I want to go to the lowest bidder, right? I want to go to the best of the best. And I think, again, going back to when we create these free markets for people, people have been so accustomed to allowing insurance to dictate everything for them, to break them out of that. One of the unique things we'll be able to do, again, is give you the tools, but then walk alongside you with this. I mean, if you're watching this and you've had a procedure with Blue Cross Blue Shield or any of the big boys out there, you didn't get a phone call from them. You didn't get any. It was, go show your card. Here, have a great, I mean, you have a baby. They're like, they don't even, you're not even sure if they knew that you had the baby, right? Whereas we want to do it different. And, when you need a hysterectomy or a spine surgery or cancer, or you have a new baby, we're going to acknowledge that internally. And we're going to, again, treat you like a human being and return those free market principles back to you, but then equip you and walk alongside you in that process.
Yeah, and I want to just like pause for a second too on like just to make sure like people understand what Cameron said. Like this will be something to watch out for the Trump administration. This will be the biggest game shifter in the insurance market that we've seen, potentially more disruptive than Obamacare itself, is if the 150 million Americans move from like think about how it used to be pensions for your retirement plan, move to 401k. That happened very, very rapidly. That happened in like a 5 to 10 year period. It was like the adoption was massive. It's gonna be a little bit longer, I think, adoption here, but the way that we actually purchase insurance may undergo a massive sea change. And I know this is going to go under the radar when these rules come out about what an ICHRA 2.0 rule would be. But a couple of tweaks to the marketplace, and you're going to see employers who want to get out of the business. They don't want their HR people running a health plan. That's crazy. Like their employers want to get out of choosing your health insurance, and there's going to be a cost effective and like venture backed innovative way from like the platforms that Cameron mentioned, the Take Commands, the remodels, all these guys. Like, you know, this will change the way it'll make Americans actually engage in purchasing insurance and seeing like, oh, like if I purchase this plan, this will save me $300 and I can spend it on this. And it's slowly start to get into that mode where like, Alex, that's where, like we are doing this as an insurer for the private market side because we know we can add value to our members to like engage with the patients. Um, the big insurance players, if they're going to lose enrollment because they don't actually provide that touch care, and you're like, my insurance company is a mess to deal with, I'm going to switch my plan. Like, if you have an employer coverage right now, you're not switching your plan. You're just sticking with whatever your employer chooses, right? And so now you're actually going to get competition to build like good healthcare solutions from the payer side. It's revolutionary. Nobody talks about it, but it is a revolutionary change that's potentially about to come onto the
Well,
scene and explode. So
yeah, I mean, back in 2015, we started, along with a couple other players, started building, Remodel Health to get employers out of the game of, health insurance, right? And how they did that was just giving their employees tax taxable wages or just canceling their group health insurance plan. You can only do that for small employers that don't have a mandate to offer health insurance, right? But what they found is that by not offering health insurance to their employees, most of their employees, especially blue collar, low income workforces, were now eligible for, tons of tax credits by the government. Now, put your, political differences or whether you think that's right or wrong aside, you then have, you know, QSERA come along, QSEHRA, Qualified Small Employer Health Reimbursement Arrangement, which was later extended or expanded into the Individual Coverage Health Reimbursement Arrangement. So like these are just vehicles, right, that allow for this bigger ideology to kind of take shape, and that is getting the employer out of. And we always said, like, they don't pay, your employer doesn't pay for your homeowner's insurance, they don't pay for your auto insurance. Why do they pay for your health insurance? Well, they do because it's a really big expense, and if you can capture quality talent and retain that talent because you pay for their health insurance, then maybe that's a good benefit for people. But yeah, so let's kind of take that approach the shift from pension to 401k, give people money, give them the freedom to invest it how they want, to invest it in their healthcare how they want. So there are some simple things. I say simple, but some simple tweaks that can be made at a federal level under the Trump administration that could really expedite the growth of the individual coverage HRA in the employer market. But really just this ideology and narrative that, like, what if an employer just gave the employee money tax free, and they could go out and purchase their own health insurance if they want. We always said,
Yeah.
if you want to use maybe if they want to use that money to go buy beer and pizza, they can. Like, it's your own liberty, right, to go buy your health insurance. But how can the employer come alongside and help support the employee paying for health insurance? And I think we're moving towards something big and something good here that's going to really change the landscape forever. And hopefully the administration finds ways to strengthen it. And I'm optimistic about it.
Yeah, and I hate vagueness, so like, to be very specific, I think the number one thing they can do is allow for the splitting of your health plan between, because right now you either have to offer an employer plan or an ICHRA if you're a large employer. So you got like people with hundreds or 1,000 employees. That's a hard thing to do, a massive sea change. The one thing the administration can do is say, get rid of that rule where you can split it. You can offer a health plan, but also offer people to get out of that through an ICHRA, and that the adoption would go through the roof. But that's a whole nother. I just wanted to be specific on one thing that I think they should do. But
there's already precedence for it, right? I mean, under ERISA, right? You can do cash in lieu. It's
Really?
not. So there's precedence for that. Most employees don't even know that they could do that, but you could opt out of your health insurance from your employer, and they can do cash in lieu of a benefit that they just give you, extra cash for it. It's usually very small amount, and it's not worthwhile doing. But there is precedence for that type of behavior.
Do we have a podcast just on the QSERAs and the ICHRAs? If not, we need to for sure put it on there. I mean, it's like a whole different ball of wax that I'm sure tons of people would be. Well, those things, you learn more about it every time you listen to it, even for those of us that know it.
Should get Scott Lingle on here, Cameron. Let's get I want to end on with a couple notes from Bob, because we are a pro-life insurance company, and like, I think that one thing we haven't touched on yet, and I think we should just conclude on this, is IVF, fertility care, something that's very much in the news. It's and very much a conveyor belt issue, Bob. Like what are your thoughts? Like, how do we kind of take this like kind of concept of sick care, healthcare conveyor belt thing, and then move it to the fertility space? Because so many people suffer from infertility. So many people, like, this is a big cross that they carry, and they're just not treated as humans.
That's such a good connection point. I think one thing that really heartens me about the Maha movement is this call back to like root cause analysis and avoiding the Band-Aid approach to healthcare, where you've got a chronic condition. I'm just going to give you a medication that covers up the symptoms, but you're going to keep living with that chronic condition for the rest of your life. How about let's get the patient involved? And look, I understand why our healthcare system has moved in this direction, because the Band-Aid approach, like you said, it's a conveyor belt approach. It's much easier to implement at scale. When we talk about the Bucas of the world, just trying to get the best metrics and data points possible. Of course, it makes sense to hand out pills like candy because you cover up all the symptoms, and you're in a fee-for-service model. So the physicians are getting paid. They're happy. The patient's symptoms are covered up. They're sort of happy, but they're continuing to live with these chronic issues. When you talk about the IVF industry, it's the same thing. It's a Band-Aid approach to an underlying health condition. I think it's something between 1 in 5 or 1 in 7 couples experiences infertility. Well, the vast majority of those have underlying um, health issues that can be addressed, that aren't addressed when their physician just sends them to a fertility clinic that pushes them towards IVF, right? So you've got stuff like endometriosis. It's treatable with surgery that's actually promotes fertility in these couples and can heal infertility at a rate that's greater than IVF. So why are we not doing that as a culture, as an industry, as a healthcare industry? Well, because it's easier and it's more lucrative, I would argue, to just send a couple to IVF. It's easier from the physician's perspective because you don't have to run a hormone panel and sit down with your client and work with them for 6 months, a year, 2 years to figure out what the underlying issue is and try something. And by the way, in some of these procedures are, if you ask a couple, are you willing to undergo operation to cure this and bring you back into homeostasis, or would you rather just go the IVF route? I'm sure some of them would say I'd rather go the IVF route, even though it's less invasive, or for whatever reason it's easier. They're exhausted from trying different options. So, but I would encourage people, and I think one thing that I'm really encouraged by in the Maha movement is this movement away from just I'm just thinking of John Paul II quote where he says, I'm sorry, it was Benedict XVI quote. He says, "The world offers you comfort, but you were not made for comfort. You were made for greatness." And whenever the healthcare industry offers you a solution that seems too good, that doesn't come with suffering, and just like avoid suffering, gives you a pill, makes you feel better, like, I'm not saying they're not necessarily wrong, but like red flags should be going up, because I think suffering is part of the human condition. It's something that we need to learn how to embrace, particularly within the healthcare industry. And palliative care will always be part of the healthcare industry because suffering is always part of the human condition. And if we have solutions that actually cost us something, that require us to engage in our own healthcare, I think those solutions tend to be a lot more promising than the Band-Aid approach solutions that offer the promise of a better outcome, but without engagement and potentially suffering, that I think is often required of us.
I love that. And I think that's another, we talked earlier about how we can help as an insurer people, get access to like panel to, the levels and the function health to take care of healthcare. This is what I found was very surprising. I mean, we've talked to some of the fertility monitor tracking apps, which is often like what you need to like find this underlying like problem that you have. Like it actually takes time to like, you track the hormone levels. The woman has to track it. Your wife, whoever your, loved one is involved, like they have to track their hormone levels, and they have massive innovation happening in this space, that really cool tools um, that can be used for natural family planning, but also used for like, achieving pregnancy. But it takes time to, first of all, you have to have access to those tools, but also you have to have access to the right physicians to like help you walk through that. And we were talking to one of these major players, and they're like, well, like most OBGYNs just are not trained to even treat this, because it's not a codable revenue item, right? Like we don't treat infertility. We send you to a clinic, and that clinic's like, well, we don't really care. We're making, $10,000-$20,000 off of this IVF. This is our option right here. Why would we send you to track your fertility and we don't make any money off of that, right? And so what's really fascinating is that the Christians, specifically the Catholic world, has really spent decades in this space since the contraception pill came out, which was one of the more controversial aspects of like the Tucker Carlson interview with Casey Means, which I thought was really fascinating to say. The first chronic pill that we gave consumers was the contraception pill, the first time that you're on it daily, monthly, or whatever, like to trick a body into thinking that it's pregnant, like obviously something that is a problematic.
And it's not, it's designed to avoid homeostasis, and
That's
as
right.
opposed to bringing your body into, like, how crazy is that?
It's yeah, and I love that they brought that to the forefront to think about, because I think people can now, okay, there's God has made us in a beautiful way. There's actually and participating in creating new life, which is, as Bob, you said, like there's suffering involved. There's a cross. All of us here have watched our wives like give birth, have the pains and sufferings of like carrying a child and all of those things. There's a cross. There's a beautiful resurrection at the end of that with a child that, all of us have held our babies in our arms. And it's like a touch, a point of touching heaven in a sense. Right. But there is that cross element, and, you know, it's picking up that cross, and there's actually a natural way to understand your body better. And there is some suffering that takes. It takes time tracking the fertility, but then also talking to a doctor. And that's where I'm really excited for what we're doing with Presidio, where we can, because the Christian Catholic world has already built this infrastructure out, all of the physicians that help you track fertility are also faithful Christians. And we've partnered with a great one called mycatholicdoctor.com, and they are the best. Like, they can hop on a telehealth call, NFP counselors walk you through your charts and really help you where the conveyor belt industry cannot. And they can help you, live out a life where you do take on that suffering in hopes of that joy of a child, and get you and kind of fill that gap where right now the market doesn't have that. And it goes back to like, we can get you access to the tools to help you monitor, but also the physicians that like know what to do. And that's just like probably the thing that I'm most excited about, is that there's going to be babies in this world that would not have come into existence if not for our little role in it, our tiny little role. And hopefully one day the four of us are in heaven and we get to meet those children or meet those and say like here we are to spend an eternal joy together, because you picked up your cross and you welcome life into the world. So that's what
Yeah,
I hope our listeners pray for, what we're doing and what I'm most excited about.
yeah, for sure. I mean, Maha it's growing. It's a big movement, and I think the the people in our country, we say the Maha moms, but people are there. There's a strong movement of people that are waking up and saying, I'm tired of this. Like, I don't want to have to fight a system, whether it be the food, system, whether it be the drug system, whether it be the insurance system, or their doctor office. Like, I don't want to have to fight a system to just be healthy. Like, I I shouldn't be. It's kind of crazy. Like, I shouldn't be the weird one. Is I think how these people feel. Like, I shouldn't be weird for wanting to be healthy. Like, it shouldn't be abnormal for me to go and buy, naturally grown food at the grocery store when everybody else has, you know, the bottle of Mountain Dews just sitting on the side of the side of their cart, right? And then they have a bunch of, Kellogg cereal, in their cart, right? So, people are tired of that, and it's crazy to even say, but the fact that like we get to play a part in that, and we're well positioned, right? Like, as an insurance company that's just starting to play a part in making America healthy again from the insurance side, and from the healthcare side, is really unique, and a nice, like, a fun challenge for us to like play a part in. And so, I get excited about that, and I want to make it easy for the Maha moms and the Maha dads and the supporters of making America healthy to like jump on an insurance plan that supports the things that they're fighting against, and makes their life easier, so that they're not feeling like they're walking into an uphill battle, when they go to their doctor office, and they've got an insurance company that's going to support the type of care that they want access to. So we uh we're going to end our time here. We're not experts on Maha, but it's fun to chat through what we're doing. If you guys have any comments or questions or need clarification on anything we said, throw it in the comments. We'd love to try to clarify it on the next episode. Thanks for bearing with us. And if you're still here and you're listening, you are amazing, and we love you. Have a great day.
Maha. Muha.